law enforcement has seized nearly twice as much fentanyl in the first 6 months of this year than the past 3 years combined. Action is urgently needed, but the Biden administration is only letting the problem get worse. In October of last year, I traveled to the border with 9 other governors. We sent President Biden a 10-point plan he could execute immediately to protect America, restore security, and end the crisis. And we asked him for a meeting. He hasn't responded, and he hasn't acted, so we have. This spring, I joined the American Governors Border Strike Force. It's a partnership with 25 other states to do the job the federal government refuses to do. Colonel Lavin is our lead for Montana on the strike force, and I appreciate his efforts. Colonel, thank you. They are on the front lines, executing drug busts, responding to overdoses, and holding drug dealers accountable. I'm grateful for their heroism. And we're also focused on treatment and prevention, because it's one of the best defenses we have to the fentanyl crisis we face. And I want folks to know, if you are or you know someone who's trapped in addiction, there are services available to help. Please reach out. We'll connect you with those services.
I consider fentanyl truly the #1 threat to Montana. And we certainly have a lot of things to be talking about, but fentanyl truly has emerged as the top threat, I think, to Montana, and I think a lot of other attorneys general would say the same thing. We are seeing unprecedented levels of overdoses, of fentanyl deaths, of interdiction seizures. Fentanyl is where the market is at right now. Fentanyl is what the Mexican cartels are pushing on our states and into Montana. I want to give you a handful of numbers. Just since 2019, fentanyl seizures have increased 58 times in Montana. We are halfway through 2022 and we are already on pace to shatter, absolutely shatter, last year's record seizures of illegal fentanyl in Montana. This is an absolute poison that is tearing our communities and our state apart. I was on statewide radio yesterday, and I had the opportunity to visit with a lady from Poplar, up in my home part of the state in Roosevelt County. That poor woman has lost 2 of her sons in 2 separate fentanyl overdoses in Roosevelt County. She's now raising her grandchildren in Poplar because those children lost their fathers. This is the stuff that is happening every day in Montana.
The model needs to include rehabilitation, but not without incarceration. Incarceration has to be part of this, so there's consequences to distribution of drugs. These people need to be taken off the streets. They are wreaking havoc within our communities. We need prosecutors and government officials like the ones standing up here today that are serious about getting to work and getting this problem solved with fentanyl. I stand here today in what I believe to be one of the most beautiful places on earth. About 30 years ago, I chose to live in this community. I chose to raise my family here. My deputies and I standing behind you recognize that it is our responsibility to continue to work tirelessly to make sure your family, your children, and your friends are safe with fentanyl.
The data speaks for itself. Massive quantities of fentanyl, large amounts of meth, rising overdoses, and predictions that were due to surpass the number of guns seized on drug cases from last year. Regardless of the negative, I have to commend the quality of the work that law enforcement and public health are doing in the field. In my career, I have never seen such a high level of collaboration and commitment from so many levels. Patrol officers, chiefs, sheriffs, task forces, prosecutors, courts, and corrections are all trying to do their part to help with this crisis. We're doing a lot of things right. We're fighting a good fight, but it certainly feels like we're outgunned and our resources are strained.
One of the things that we've been doing in the Highway Patrol to help combat this issue with support from the Attorney General is we've deployed 2 criminal interdiction teams across the state. They primarily work interstate areas. They work with the local partners. They work with their federal partners, and to combat this serious problem in Montana. So We've also increased our canine operations plan due to the grant program through the Attorney General's office, along with our local partners as well.
We also have human trafficking that we're going to have the consequences and experiences of for another decade going into the future. We've got human indentured servitude that is taking place with many of these illegals that are coming across our southern border. But this fentanyl crisis is something that is taking place right now, and you can very easily, as you've heard from the Attorney General and from the law enforcement agencies behind us here, connect the dots from Bozeman, Montana, all the way back to Beijing, China.
This that is affected Montana, and that is the scourge of fentanyl. If I were to ask you what's the leading cause of death for 18 to 45-year-olds in this country, you might say suicide, you might say COVID, you might say car accidents. The leading cause of death this past year for 18 to 45-year-olds is fentanyl. The drugs are coming from China. They're coming into Mexico and manufactured and then coming across our southern border. There are two cartels primarily that are driving this: the Sinaloa cartel and the Jalisco New Generation cartel. What they do is they put drones up on the southern border. They're monitoring the flood of illegals coming across the border. And when they see where the illegals are coming across, they then radio to their drug smugglers, their mules, to get the drugs, the fentanyl, across the border. That's why the crisis on the border of some 2 million illegal apprehensions that are coming across ties to this issue of drugs and how it ties directly here to Montana.